Hello everyone.
Hi, Minister.
I finally logged on. Sorry to keep everyone waiting. I wish I can be with you in the ballroom, but I'm currently on isolation after returning from the G20 Health Ministers meeting. So let me just deliver my speech today over Zoom. First, greetings to the Chairman of EU-ASEAN Business Council, Mr. Donald Canup, Excellencies, distinguished guests, ladies and gentlemen. All health ministers today, we are seized with managing the ever-evolving COVID-19 situation while still worrying about the significant challenges regarding the health of our populations and our healthcare systems. However, as abruptly as we were thrusted into the COVID-19 storm, every country had to adapt quickly to battle the evolving virus. We rolled out vaccination, tested our population widely, imposed social distancing measures, contact trace, quarantine those exposed to the virus. It is I would say, a frantic period for all of us, but a lot of good has also come out of it, because I'm an optimist by nature, because we were forced to build up healthcare management capabilities in double quick time, and capabilities that in peacetime we might not have built. Throughout history, capabilities built up to respond to emergencies and crises and proved to be enduring over time. Controlling floods in China helped build up central administrative capabilities. Earthquakes resulted in better building materials and methods. Wars propelled the advancement of technology used largely for peaceful purposes now. So likewise, the capabilities we acquired in fighting the COVID-19 crisis has long-term relevance to our healthcare systems. Today, let me share a few of such relevant capabilities. First is the wider adoption of vaccines. Many countries have rolled out nationwide vaccination programs, which were largely kept voluntary as they were approved under emergency use. Governments thus had to explain to their people how the benefits of vaccines far outweigh the risks, and that everyone needs to do their part to get vaccinated to overcome the pandemic. Many countries have achieved admirable COVID-19 vaccine coverage for their population. In Singapore, 82% of our total population have taken both doses, and 85% have taken the first dose. And through this exercise, almost every child, adult, and senior now know about vaccines and how they work, that there are different technology platforms. No vaccines are 100% protected, but can make a big difference when it comes to saving our lives. It is the collective action of everyone coming forward for vaccination that helps to build up herd protection, and we should be alert to misinformation and falsehoods about vaccines. Precious lessons that we would not have learned as a population without COVID-19. Today, our children are well vaccinated against diseases like hepatitis B, BCG, and MMR. However, vaccination rate for diseases like influenza has been low. Based on the 2019 National Population Health Survey, about 1 in 5 Singapore residents aged 18 to 74 years reported taking an influenza vaccination in the past 24 months, only 1 in 5. Partially due to the low take-up of the influenza vaccine, we still have 600 to 800 deaths from influenza yearly in Singapore, which could have been prevented by influenza vaccines. So I hope that post-COVID-19, with greater awareness of the benefits of vaccination, our vaccination rates for the other infectious diseases will pick up as well. And this will help us avoid more vaccine-preventable diseases and deaths. Second, a stronger primary and community care system. During the COVID-19 crisis, when infection numbers climbed, every healthcare system instinctively wants to protect its intensive care and hospital capacity for those who need the medical attention the most. They therefore decant those with mild or no symptoms due to COVID-19 to recover at home or in community health facilities in the case of Singapore. In fact, for patients with mild symptoms, it is often better for them to be taken care of by community general practitioners or family doctors than by hospital staff. A crisis like this brought out the importance of primary and community care as the first and most important line of defense. For example, we relied on ARI or acute respiratory illness testing at the primary care level to identify COVID-19 cases early and initiate public health actions. This also allowed us to gauge the extent of community transmission. And when it came to vaccinations, it was the primary care doctors who managed to persuade people who were hesitant, and especially our seniors, to get vaccinated. Because these family doctors are not just doctors, but trusted family friends. As our population ages, the community care setting is key to our efforts to right-site healthcare. And this is where we screen our population for chronic diseases, dispense medical advice to help people lead healthier lifestyles, and take preventive measures. We want to avoid the hospitals because by the time we need their services, it is often too late. We should focus on healthcare and not sickness care. And the former must take place in the community at the primary care level. Third, COVID-19 presented an opportunity to make telemedicine an indispensable feature of our future healthcare system. Telemedicine is not new to Singapore. About 3 years ago in 2018, we introduced a regulatory sandbox for telemedicine to gauge its acceptance, better understand the benefits and the risks, as well as co-create solutions for the industry and with the industry. However, like new things that concerns our health, the take-up has been patchy. COVID-19 has forced us to quickly scale up the deployment of telemedicine operations to support the fight against COVID-19. And this is especially when we are pushing for more home recovery for COVID-19 patients who are fully vaccinated, young, healthy, and have no or mild symptoms. Remember, in Asia, our starting point was to follow the medical protocol for SARS, and all COVID-19 patients have been warded instead of recovering from home. So switching to home recovery now requires quite a mindset shift, and the provision of 24/7 telemedicine support allows us to provide greater reassurance to the patients. The pandemic has therefore brought digital health technologies to the fore. Post-COVID-19, I hope there is greater acceptance and confidence with telemedicine, and healthcare can be made more accessible and brought effectively to the comforts of one's home. Fourth area, personal hygiene, something as simple as that. In 2020 and 2021, these past 2 years, the incidence of influenza, other bacterial and viral infections have plunged. Hospitals are reporting record low hospitalization due to such infections. I, for one, I have not fallen sick since the beginning of last year. This can be attributed to our population observing safe distancing and, importantly, wearing masks and practicing good hygiene habits, such as washing our hands more frequently. Singaporeans do not have the habit of wearing a mask when they are ill, but now everyone is wearing one. In our public hawker centers, we instituted a new rule for patrons to return their trays, something which we probably should have done earlier. In schools, we also instituted a new practice where students will clean up and sanitize the table after their meals in the canteen. And I heard some of them continue to practice that when they are at home, to the great delight of parents. So good habits need to be inculcated young, and the pandemic turns out to be a good time for us to start the effort. So I hope all these can become permanent habits of Singaporeans, and it will make us so much healthier and so much more resilient to diseases. Fifth, we now have an opportunity to develop Singapore into a vaccines supply chain and manufacturing hub. Despite COVID-19, our Changi Air Hub continues to serve as a node in the world with a comprehensive network of connections. We have been investing in pharmaceutical cargo capabilities, such as cold chain or ultra cold chain infrastructure. And today, Singapore serves as a COVID-19 vaccine distribution center to regional countries in Southeast Asia, Australia, New Zealand. Building upon our existing base of pharmaceutical manufacturing capabilities, we have further attracted investments from global pharmaceutical companies to manufacture vaccines in Singapore. BioNTech, for example, has announced plans to establish its regional HQ for Southeast Asia in Singapore, and it will be a fully integrated mRNA manufacturing facility in Singapore around 2023. The facility will supply a pipeline of mRNA-based products and can rapidly respond to potential pandemic threats in our region. Sanofi, too, has announced its plan to invest euro 400 million to build a new vaccine production site in Singapore. It will be a regional center of excellence with multiple vaccine manufacturing capabilities. And lastly, Thermo Fisher Scientific announced that it would establish a new US $130 million fill and finish facility by 2022 to manufacture vaccines and therapeutics in Singapore. Finally, COVID-19 has helped us become more prepared for future pandemics. After SARS in 2003, we had a robust system to contact, trace, and isolate individuals exposed to such viruses. We also decided after 2003 to build a national center for infectious diseases with 330 beds in 17 isolation and cohort wards. 17 years later, these investments in capabilities and infrastructure have helped us immensely as we confront COVID-19. With COVID-19, we have again built up a whole new arsenal to deal with future pandemics. We know we are now able to roll out a national vaccination program for the whole population. We have a system of widespread testing and surveillance with more than 10,000 PCR tests per million population per day to detect outbreaks in the community. We have the know-how to conduct phylogenetic studies and variant detection. We now have an IT system leveraging Bluetooth technology to elevate our contact tracing capability to the next level. We have put in place a multi-tier system of medical care for infected individuals with varying degrees of illness severity. Most importantly, we have a people hardened by the pandemic crisis such that we know how to cooperate with each other, exercise civic consciousness, and work in unison to overcome a major challenge like COVID-19. And these are improvements that are important to our pandemic preparedness for any future crisis. The secretariat of this summit asked me if I could share Singapore's model of responding to COVID-19. Let me say a few words on this. Today, Singapore finds itself in a rather unique position. We know that it is not possible for a global city-state like us to eradicate the virus within our borders. Lockdowns inflict pain and suffering to many workers, families, small businesses, especially the small businesses. We will need to open up social and economic activities progressively and safely. People in Singapore, from families, students, workers, executives, businessmen, entrepreneurs, scientists, researchers, leisure seekers, must be able to travel out of Singapore to other countries and then back again without prolonged quarantine. This is what makes Singapore tick. We have therefore decided to embark on a journey to transit to a resilient nation that can live with COVID-19. But the path we take will not be straightforward, but full of unexpected twists and turns. More importantly, Singapore is trailblazing a road that I don't think others have trampled on before. This is because we know that to live with COVID-19, there must come a time when we will have to ride through at least one big wave of transmission in the community. Most countries, including many European countries, went through this the hard way and paid a huge price in human lives. Today, you have opened up and people go about their lives quite normally, but only after going through those hardships. Singapore is in the middle of a big wave of transmission in our population right now. The difference is that we are doing so only after vaccinating over 80% of our population. So we are riding this wave in a relatively naive state, without natural antibodies, but with vaccine-generated immunity. Currently, we are monitoring quite anxiously to see if vaccinations will prevent the rising number of infections from translating into many more severe illnesses and deaths. This will give us the confidence that we can live with COVID-19 safely. And this is where we stand currently. Over the past 23 days, which is when our wave started, there were about 6,600 new infections detected, with 7 admissions to ICUs and 2 deaths, predominantly accounted for by unvaccinated individuals. So the next few weeks will be crucial. So I'm afraid I have no answers on what is the best battle plan or model of response against COVID-19. I can only share that we are at a critical moment, and the outcomes in the coming weeks will guide our next steps. We are in this current position because of the unique approach that Singapore has taken to accelerate our vaccination program and take calibrated steps to reopen our society and economy. And this is an outcome of medical science, as well as the people who are prepared to hold the fort against the virus until we feel we are sufficiently inoculated. And we are fortunate to be in this position and to be able to adopt this approach. COVID-19 does not recognize nationalities and is a common threat to humankind. Every country and people has been put through a stringent baptism of fire. In that process, the world came together in many ways, sharing scientific discoveries, findings, and know-how in combating the virus, and linking up our supply chains to deliver test kits, medical equipment, and vaccines. We are learning from each other. For example, over the past 20 months, we witnessed the healthcare responses of European and Asian countries, and they are quite different. For Europe, the starting point was closer to a response for an influenza outbreak, where individuals rest at home and seek medical help when they are unwell, but that proved to be inadequate against a deadlier virus like COVID-19. In Asia, many countries' starting point was SARS, where every case was hospitalized and his contacts identified and isolated to prevent future spread. But that proved to be unsustainable, as COVID-19 is far more infectious and affects many more people. And there are just not enough rooms to go around, hospital beds to go around. So over time, European countries too started to conduct tracing and isolation, while Asian countries like Singapore are making home recovery the default for vaccinated individuals who are healthy with mild or no symptoms. I also hope that as soon as we are ready, Europe and Asia can start to rebuild the bridges across our continents again. Singapore and the EU are in discussion on mutual recognition of health certificates, which will pave the way for us to reopen our borders to each other safely and when we are both ready. At ASEAN, member states have committed to the ASEAN Comprehensive Recovery Framework, which was adopted at the 37th ASEAN Summit last November. The framework serves as the region's coordinated exit strategy from the COVID-19 pandemic and reflects ASEAN's commitment to build back better in a pragmatic and sustainable manner. The key initiatives include the establishment of the ASEAN Regional Reserve of Medical Supplies for Public Health Emergencies, the ASEAN Travel Corridor Arrangement Framework to revive essential business and official travel within ASEAN while prioritizing public health and safety. All these demonstrate a spirit of cooperation between countries and between regions. So may this spirit of cooperation stay strong to help see all of us through this pandemic. Thank you, everyone.
Thank you, Minister. If I may now invite Ottilie Edwards, presenter at the award-winning regional broadcaster CNA, for a moderated Q&A session with Minister Ong. Ottilie, anytime you're ready, the floor is yours.
Thank you, Liana. And thank you, Minister, for staying back to answer some of our burning questions about the pandemic. I guess being quarantined, you have nowhere else to go anyway for a while. And we appreciate
my last day.
Now, we have seen how Singapore has done it. And even at its very best efforts, cases are rising again. We've got 800 over cases reported as of midnight yesterday. And obviously no thanks to the Delta variant. And based on the latest announcement by the Multi-Ministry Task Force, for instance, we're taking steps to curb this ongoing rise in COVID-19 cases, including booster shots for seniors. I believe that's starting today. And also to prevent hospitals from being overwhelmed, a pilot home recovery scheme. Now, based on what is trending, I have to cut to the chase and ask you, Minister, we mentioned about unvaccinated people and how they kind of hold the key to how fast Singapore can actually open up. And I know you've mentioned before that Singapore is not ready yet, it's not the time to mandate vaccination for all those who are medically eligible for it. But Minister, do you think that there will come a time, and at what point, where, like, as we've mentioned before, children, have to be vaccinated, get all their jabs before 2 against measles and whatnot, that there will come a time perhaps for Singapore where we have to mandate, vaccination for all those who are medically eligible for it?
Well, currently, all the vaccines are approved under emergency use. And so it's still an international practice across different regulators and authorities around the world that the COVID-19 vaccines are not mandatory. So our practice is in line with what other countries do as well. So you raise a hypothetical question of many years down the road, maybe it will become mandatory, but I think as of now, that is the position held by all countries. And therefore you see different countries having different, successful to different extent in persuading people to get vaccinated. And in our case, I think we have been very successful. Covering, and in fact, we are 85%, over 85% first dose, which means in 3 weeks from now, 85% of our entire population, not eligible population, entire population will be vaccinated. So this is actually quite a remarkable achievement. I think it shows the mutual trust we have amongst the people and between the authorities and Singaporeans and the people of Singapore. So with that, I believe we have built up a very strong defense for ourselves. What is more important, I don't think lies in mandating vaccination, but really observing the trajectory of the infections and how that trajectory of infections translate into the trajectory of ICUs. I reported just now in my speech, so far it's a handful after 23 days into this wave. So far so good, we're keeping our fingers crossed and we'll continue to watch it closely.
Now, as you've mentioned, vaccination is currently at 82%. 85% of those have had their first dose. Very high, vaccination rate in the world. We're proud of that. But at the same time, we still have dining in, for instance, capped at 5. Alcohol stops, flowing at 10:30 in restaurants outside. And the workplace socializing, for instance, is prohibited. Obviously, work from home is a preferred choice. All these measures, precautionary measures. Looking at your smile, you might know where I'm trying to direct that question.
Well, I don't know. I'm figuring out you're directing it one way or the other.
So, and in terms of numbers, I mean, these are just some of the numbers I have. We have 700 in hospital, about 35 need oxygen, 7 in ICU. Some might actually say that, the government's recent moves might be a bit too cautious. Your take on that?
Oh, I get a lot of those messages and emails. For friends who know my phone numbers, they text me all the time and give me that feedback. But for every one of that, I also get another one to say, why don't we lock down and bring back heightened alert? And there are many people who also text me or write to me to express that view. So there is a range of risk appetites around Singapore. But I think we have to do what we feel is currently scientifically correct. And it goes back to the fact that we are taking an unprecedented path. Most countries go through this kind of wave before they were sufficiently inoculated and suffer many deaths. But right now, you can see that after this wave, after going through such waves and incurring many deaths, they settle down to a level where society can get back to normal. And they have very few deaths. Denmark, for example, I think is quite amazing. I'm watching it closely. Netherlands as well. They are around the size of Singapore, especially Denmark, with a few hundred cases a day and very few deaths, and in fact, hardly any deaths on most days. So that is like, to me, an ideal situation. But they went through 2,000 over deaths before they can reach there. So we didn't go through that because we were tight in terms of our safe management measures. But now that we are over 80% vaccinated, we open up. Even with only 5 people able to meet for a meal and work from home at 50%, we generated this kind of wave. So if we can go through it without suffering, without having to pay a price in human lives, and I think it is an unprecedented path. And so right now, the correct thing to do is neither agree with my friends who text me to say, please lock up, nor agree with the other group of friends that tell me to please free up. They're all my friends, they're still all my friends. But to hold our position, not to reverse, not to charge ahead, hold this position, I think, at least for the next 2-3 weeks to observe the situation. It's probably, I feel, the right thing to do.
Fair enough, Minister. I mean, I guess the reason why I was trying to ask that question was just sort of linked to my next question about, I mean, all these restrictions we have. And, people in Singapore, it's not like we have domestic tourism, going to Sentosa is a real treat nowadays. There are just a lot of inconveniences. And just with all these restrictions, mental health has also come to the fore because, studies have shown that prolonged restriction also worsens depression. There have been spiking calls to Suicide Prevention Agency amid the COVID-19. And I'm wondering, in terms of providing mental health services to the community, and not to mention also our, taking care of our migrant workers and their mental state of health, do we have the right expertise, to get up to speed in that area?
I think we are building it up. I do agree with you, and I think in the end, most people in our population will agree with you that we have to open up eventually. If we continue the rest of our lives in this current state, there is no hope for our children. They want to be able to travel, to gather with friends, to do their CCAs, and we cannot promise them a life where you will be locked up and you are safe against COVID-19, but that's the life you lead. It can't be. We have to open up, especially a small city-state like us. But there is a path and a transition plan for us to get there. And right now we are proceeding along our plan. Let's stay to our plan and not get sidetracked, because now is not the time to either reverse or to charge ahead. Yeah, now is actually a critical time for us to monitor. I do not underestimate the issue you raise about mental health arising from COVID-19. Yeah, I think it is happening over and above a global observation that mental health issues are actually on the rise. It is actually a global issue. I have my own hypothesis on why is it happening, but I leave it to the experts. I think later there's a panel discussion with Dr. Janil. He's chairing our task force on mental health and wellness. Maybe you should ask him. But when we discuss, I think we both agree that there's the medical aspect, which we probably have to build up and look into, but there's also a non-medical aspect, because like all illnesses, by the time you require hospital care, it's probably too late. So a lot of preventive care, a lot of wellness care rather than sickness care is more important, and mental wellness is the same. I think there's a lot more we can do in schools, in communities, amongst networks of friends, to pick up skills, just like we pick up knowledge about infectious diseases, about vaccines, about keeping our hygiene. There's a lot of knowledge for every one of us to learn to take care of our mental health. And this is another journey that we need to go through.
And as we talked about, opening up and getting the opportunities to travel, obviously, we can't defeat the virus on our own, as what DG of EU has mentioned. Can you just outline for us how you think Singapore would like to work, with the rest of ASEAN in terms of tackling COVID on the basis that, business and society need more than Singapore to open up?
Repeat your last sentence, I missed it.
Singapore, working with the rest of ASEAN in tackling COVID-19, can you outline for us some of the plans on the basis that businesses and society need more than Singapore to open up?
Okay. Well, I mentioned just now, one of the things that we are doing is to serve as a storage and distribution center for vaccines. And I think we've been doing that after we invested in our ultra cold chain that mRNA vaccines require. And today we are serving the region from that perspective. But I think going forward, what is most critical is that for each of the country to be able to keep our pandemic under control. Malaysia is vaccinating at a fast rate. Brunei is getting on. So is Indonesia. I just met Pak Budi, the health minister in Italy. We have a very good exchange of views. And so does other countries within ASEAN. And further afield, Northeast Asia, Australia, New Zealand are also proceeding with their vaccination program. There will come a time, I believe, that vaccines will work and will bring the pandemic under control. And when things are safe and we are confident, the next thing we need to do in order to cooperate and work together again is to reconnect our countries and our cities. Without regional connection, without international connection and people-to-people exchanges, it's very hard to bring businesses, people, scientists, everyone together to cooperate. There's only so much we can do through Zoom and Skype. So we need to start re-establishing that. And therefore, our pilot project of a vaccinated travel lane with Germany is an important one. So far, it has worked very well. And I believe we can continue to do so. You replace quarantine with tests in order to open up travel between two countries and two cities that are confident about each other's system. And so if that works, and when the time is right, we should do likewise with other cities within ASEAN. And those are the two critical steps to take.
But mean, just on a practical level, it's, you know, like going to Germany and coming back, for instance, you still need to get 4 PCR tests, you know, which is about $160 times 4. If you go out for the family of 4, it's still costs quite a fair bit. I'm just saying in terms of a practical level, it's a start, I agree. But
yeah, it's a start. Cost is high. Over time, we hope cost can come down. Over time, we hope PCR perhaps can be replaced with ART, and ART tests can also come down. So we are all learning and all plotting this path. What you are seeing is probably we are 50% through our journey. There's another 50% to go. Don't underestimate the resilience and adaptability of humankind. You just look at how far we have come in tackling this pandemic. It's actually an amazing story and an amazing history to read when our children grow up. You just think about how the genome of the virus was just mapped out, you know, within a week, and then PCR test was then invented, a phylogenetic test were done, and all the things that we have done, and then vaccines coming on stream and rolled out in every country. And I think there's still some journey to go, but the resourcefulness and the resilience that we have shown and different countries have shown, I think will shine through again.
And so I think, you know, now if we get the opportunity to travel again, if anything, we're going to appreciate and value each and every vacation we have even more. So, Minister, just before I let you go, I've just got 2 very quick questions. First up, I saw some pictures of you on Instagram when you were at the G20 Health Ministers meeting and you were going mask-free, and I was quite envious of that. And I'm wondering, when do you think Singapore can go mask-free?
Well, I got some comments on my IG photo that why am I not wearing mask? But you know, I was in Rome, and literally when in Rome, you follow the Rome's rules. And so for them, we get tested almost every other day. And so all the health ministers are tested every other day, and we are outdoors. We need not wear our mask, but once we go indoors, we wear our mask. When are we mask-free? You know, I can't tell you, I'm afraid, but I will say this, that mask may be one of the last things to go, because it is something that we can all do. It's simple to do, and yet the payback in terms of slowing down the R0 of Delta is actually significant. So I think it's not one of those priorities that we are looking at.
Sure. And finally, your scorecard for Singapore's handling of the pandemic out of 10.
This asking me what's your, it's like determining your life achievement based on your PSLE scores. But I think it's not a fair question. So
10 upon that 10 then. All right, thanks very much, Minister, for taking the time to speak with us. I hope you will enjoy your quarantine.
I have been enjoying. Thank you, Odali.
Thank you so much, Minister, for joining us. Please, a round of applause for Minister Ong Ye Kung.